factors: race and ethnicity. For example, here they give an example. For example, the Black African American individuals facing high HIV diagnosis and prevalence compared to the other groups. Moreover, a study revealed that African American and American Indians have a higher age-specific death rates compared to white individuals across various groups. Despite advancement in healthcare, access remains a challenge for many due to factors like lack of health insurance, a higher cost of care, despite advancements in healthcare, access remains a challenge for many due to factors like lack of health insurance and higher cost of care. While US has seen a significant decline in HIV-associated mortality due to effective treatments and prevention programs, HIV continues to disproportionately affect specific population, particularly minority groups, according to the CDC. This is in the United States. So going below to the South Africa, you will see here there's a pictures, and this pictures is showing hold on. This picture is showing people manifesting or protesting for the health work in South Africa. So, but South Africa here grapples with profound healthcare inequality, largely stemming from the historical legacy of apartheid and persistent socio-economic disparities. The country operates with a two-tier healthcare system where a well-founded private sectors caters to a minority of the population, while the underfunded public sectors serve the majority. Access to healthcare service is particularly limited for marginalized communities, especially in rural areas, due to a geographic isolation, inadequate infrastructures, limited resources, and economic constraints. Here is in South Africa. Now it's going to say South Africa carries a disproportionately high burdens of global HIV epidemic, with the highest number of HIV infections in the world and high disease prevalence. Now, this has had a devastating impact on the health system and overall life expectancy. The HIV/AIDS epidemic affecting the country's health profile, contributing significantly to disability and premature death. So this is causing premature death and disability, and here in South Africa. Now, slide 5. In slide 5, we are going to compare and to see comparative analysis for the both countries. Now it says both countries demonstrate a strong influence of social determinants of health on health outcomes. Both countries demonstrate a strong influence of social determinants of health on health outcomes. However, In South Africa, those factors are deeply intertwined with historical inequalities and led to a more severe and widespread impact on health and access to care. South Africa faces a much greater burden of HIV/AIDS compared to the US, particularly in terms of prevalence and impact on mortality. Oh my goodness. Now let's go to the US. The US is a largely privately driven healthcare system where insurance coverage is paramount for access to quality care, not or according to Peterson KFF Health System Tracker. In contrast, South Africa's DAO system creates a stark divide in the inequality and accessibility of services based on income and insurance status. Going to slide 6, you will see a note that I added here talking about impact of HIV/AIDS, effects of HIV/AIDS on individual, families, and household. Now it goes, you're gonna read here, you're gonna see. So, but the aim of my slide here is to address the problem in short. And my findings here shows that South Africa is now actively addressing the health system inequalities and HIV/AIDS disparities through a multi-project approach. This is a system that they are using to address the problem to the community or around the world. This includes implementing the national health insurance scheme, strengthening primary health care, and focusing on human resources for health, and tackling HIV specific challenges like treatment access and prevention of mother-to-child transmission, which is very good. I like this one because our mothers are giving kids HIV through breastfeeding or through blood. So what South Africa is doing here is to prevent the transmission that can happen to the kids and the mother, transmission that can happen to the child and the mother. So which is good, and I like this is a good system of protecting babies from having or from being contaminated from HIV/AIDS from their mothers. Very fantastic. This is good. Going forward, we're going to see slide number 4. And this slide number 4 is just a note that I added here, and it's showing nation HIV prevention strategies. And now saying the purpose of the nation HIV/AIDS strategies is to provide a roadmap for public and the private stakeholders to better address the serious ongoing HIV epidemic in the United States. The three primary goals focus on reducing the number of population who becomes infected with HIV. The second, increasing access to care and optimizing health outcomes for people living with HIV and reducing HIV-related health disparities. Oh my goodness, this is a good one. Yeah, this is a good one. Now going to the slide number 8. Slide number 8, you're gonna see the HIV/AIDS medication, and you're gonna see the word HIV/AIDS treatment. So this is showing how HIV being treated or somehow. Now, the aim of this ad or the aim of this slide is just to solve to address or addressing health system inequalities and HIV/AIDS disparity. All right. Now, let's go on. The US, let me see the US. The US addresses health system inequality. This is how the US now is addresses. We have seen how the South African is addressing the issue and to prevent mothers and kids or child transmission. Now here, this is US now, my country of citizenship here in America. It says the US addresses health system inequalities and HIV/AIDS disparities through the multi-project approach focused on prevention, treatment, and addressing social determinants of health. I think it's almost the same with South Africa, all right? Because they are using the same approach, which is Mount Project approach, which is almost the same, right? But here, America is focusing on prevention, treatment, and addressing social determinant, which is good. We need to focus on let people know the social determinant because we are being triggered by social determinant. So people should know exactly and know how to protect themselves from this social determinant. Now, social determinant of health. Now, the key strategies that US is using include expanding access to testing and treatment implementing targeted prevention program and tackling the root cause of disparity like poverty and lack of education. Those are the two major social determinants. Yes. I may say yes because most of people, let me try to explain it over here. Most of people, because of poverty, especially female, are involving themselves in selling their body to get money. Then in selling their body, that's when they got a feedback of HIV contamination. Oh my goodness, it's not good. Now, when it comes to lack of education, now, yeah, they don't have some skills, they don't have some knowledge about this um, disease, or somebody does not know exactly how does it affect, how this disease affects, or the consequence of this uh, HIV. Now they end up getting some problems falling in this trap because of lack of education. Therefore, education is wonderful. I may advise parents to be sending kids to school. Let educated education be number one in the family or community. Yeah, that's good. Now going to slide number 9. Slide number 9 is talking about impact on the problem, impact of um, these inequalities, this healthcare system inequities and disparities. So as you see on this art, you will see some impact that people are facing. I did not talk much about this one, but if you read, there's a race, ethnicity disparities in HIV and so on. You will see disparity in PRE use relative on need. You see everything here. I did not talk much about this. Now going to the slide number 10. Slide number 10 is gonna ask us what should be done to deal with the problem. Yeah, what me and you should be doing to prevent ourselves. Now it's gonna take us back now. This is gonna take us back to slide number 9, where it says impact of the problem. Now, since you know the impact of the problem now, we're gonna see now, we're gonna ask ourselves, what should we do to to protect ourselves? What should we do to deal with the problem? All right. Now, going forward, as mentioned above, addressing the problem requires multi-project approach technique that focuses on both the health system itself and the broader social, economic, and political factors that contribute to those disparities. And by addressing the factors that contribute to HIV disparities, strengthening health systems, using innovative intervention, fostering international collaboration, progress can be made toward a world without HIV and AIDS, and ensuring that everyone has the rights to health and well-being. Oh, this is like an advice. This is like a suggestion, which is good. You can see that as mentioned above. So addressing the problem, it will require the same, the same, the same system, the same way that South Africa and American are using to address the issue, which is a multi-project approach technique, which is focusing on both health system itself and the broader social and economic factors that contribute to HIV disparities. This is strengthening health system using innovative interventions, fostering international collaboration. Then the progress can make toward a world without HIV and AIDS, and ensuring that everyone has the right to health and well-being. So yeah, we should let everybody has the access to his health and well-being. And we let this one happen. How can we let people have um health and well-being, right to the health and well-being without insurance? So the medical insurance need to be provided. Let people have their autonomy, self-determinant, something like that. Yeah. Now going to the slide number 11. Slide number 11 is going to show the prevalence on both two countries that we are comparing. Here you're gonna see the picture, the map. This map is for Africa. Because the prevalence that I'm showing here is not gonna be for South Africa only, but it's gonna be for the all Africa. But when you go to South Africa, you're gonna see South Africa is down here, behind Lesotho. Lesotho is behind here, and Swaziland is here, which is Swatini these days. And here is Botswana. Now we are comparing this South Africa with USA. Okay, let's go on. The prevalence says the HIV epidemic in South Africa is heavily influenced by disparities within its health system, and this is true, and broader socio-economic inequalities. Overall, HIV prevalence 2022, which is here, shows that approximately 13.9% of South African population, about 8.45 million people lived with HIV. Now, adults 15 to 49 were affected. Let's go in 2021. 2021, around 8.2 million people were living with HIV, and the adult age 15 to 49 years old were 19.6% living with HIV. Now it says HIV prevalence varies considerably across different provinces. This is South Africa. For example, in 2019, KwaZulu-Natal had a prevalence of 27.0% among adults aged 15 to 49. This is one province, which is KwaZulu-Natal. Now, what the Western Cape, Western Cape, this is on the west side of South Africa, had a significantly lower, which is down number. The number was decreased. Lower prevalence of 12.6% within the same age group. See, in Eastern Cape, there's Western Cape, and there is KwaZulu-Natal. Now, KwaZulu-Natal, the number was high, 27%. Then Western Cape, the number decreased to 12.6%. Now, is they're saying, but the highest risk of HIV is observed in Eastern Cape, which means when you go to Eastern Cape, the number was raised, is too high for people living with HIV. So this is prevalence for the South Africa. So going forward now, we're going to see slide 12. And this slide 12 is going to show prevalence in US. Now, let's see what they're saying. As said above, health system inequality and disparities in HIV/AIDS in the US disproportionately affected specific population, particularly racial and ethnic minorities, gay, bisexual, and other men who have sex with men, transgender individuals, people who inject drugs, old adults, and people experiencing homelessness. Those are the people who are facing much with this issue. Now, although 12% of the US population accounted for 39% of HIV diagnosis and 40% of people living with HIV in 2022 accounted of 26% of people living with HIV, and 32 of new HIV diagnoses in 2022. Both disparity, male and female, were significantly more likely to have HIV and AIDS compared to no Hispanic white individuals in 2022. The social determinants that contribute to those disparities are poverty and homelessness, insurance coverage, geographic disparities, and stigma and discrimination. Those are the social determinants that are causing people having these kind of issues. And as we said above, this is why we need to focus on avoiding these issues that are triggering us to have these kind of problems, according to the CDC. Yeah, according to the CDC. You will find all this information. Let's go to slide number 13. Slide number 13 now is gonna tell us about impact on outcomes. And on this ad here, on the pictures which is added on the notes, is gonna show determinants of health. This is one of the determinants of health. They are showing that working condition, they are showing physical environment, they are showing education, they are showing genetic endowment, they are showing coping skills and social support, something like that. But going to the notes, saying those disparities and social determinant like poverty and homelessness, insurance coverage, stigma and the discrimination, and geographic disparities impact health outcomes for people with HIV, and it causes treatment gaps, late diagnosis, and an increased mortality. Yes, this is why I say, what should we do about the and we saw the impact of the problems. And now here we are seeing impact on outcomes. And now we are seeing that impact of outcomes is treatment gap, later diagnosis, and an increase of mortality. And this is true because of poverty. There will be treatment gaps. I don't have money to pay. Then because of poverty, my diagnosis is gonna be late, and sometimes don't be. It won't be. Because of poverty, people will die, lose their lives. So the mortality will be increasing. The child will, because of malnutrition, no medication, so people die. So those are the outcomes, the impact on outcomes. So we need to deal with this. So going to 14, slide 14. Slide 14 that say the same. Both countries demonstrate, which both country means South Africa and America. Those both countries demonstrate a strong influence. They are trying their best to demonstrate a strong influence of social determinant on health outcomes. Those are the outcomes we talked about. Now those two countries are showing strong influence of social determinants of health on health outcome. However, let me see South Africa. However, in South Africa, those factors are deeply intertwined with historical inequalities and led to a more severe and widespread impact on health and access to care. They went ahead and say South Africa faces a much greater burden. South Africa, this is where it compared with US. It says South Africa faces a much greater burden on HIV/AIDS compared to US, particularly in terms of prevalence and impact on mortality. So I may say that maybe in South Africa, they have high mortality than America. Yes. Now, the US has a large private-driven healthcare system, which is good, and I like it, where insurance coverage is paramount for access to quality care. Not as according, this is according to Peterson, KFF Health System Tracker. Yeah. Now, in the contrast, South Africa's DAO system creates a stark divide in the quality and accessibility of services based on income and insurance status. Yeah. Now let's go to slide number 15 and see exactly government's role. And I like this one because it's like a policy, which is good one. Let me see. Government should continue to play a role in safeguarding public health and curbing the spread of HIV and AIDS by enacting and implementing comprehensive strategies that address various aspects of prevention. Yes, we are focusing on prevention because we need to be prevented from this kind of disease. It's a dangerous disease. And I like this one. The government should do this. Government should go ahead and try to prevent their population, their community from this kind of disease. Wonderful. Now, MC strategies like implement and enforce robust, robust policies and registration. Invest in comprehensive prevention program, ensuring access and equitable treatment and care. Investing in research and development, promoting international collaboration and partnership, and so on, which is good. I like it. Slide number 16 is gonna show us slide number 16 is gonna show us different kind of general socio-economic and culture and environmental conditions. Here they're showing living and work condition. Here they're showing work environment, they're showing unemployment, education, agriculture and food production, housing, healthcare, water, sanitation, and employment. Social and community network, individual lifestyle factors. And I think this is good one because all this contributes in uh, in our disparities or in our health system, right? Because unemployment is, I can call unemployment one of the social determinants also. And this is the poverty, right? If you don't work, yeah, you're gonna start going out, selling your body to get money. You're gonna start going out, doing something wrong, gonna be homeless, start staying outside with no choice. So I think this is a good ad that can explain social determinants and that can advise us. Remember we said social determinants, lack of education. Education is here, poverty here, work environment, unemployment, and other things like water sanitation. Yeah, we need to have good water. Health service, we need to have insurance. Housing, yeah, if you are poor, can you get, if you don't work, can you get housing? No. This is when you find somebody on the street, homelessness. Yeah, homelessness as a social determinant. Living and working condition, this one and this one and this one may be put in the same category. Education, agriculture, which kind of food do you eat? Yeah, that's something like that. Now, let's go back to 16 and see what they're saying here. On 16, how can people protect themselves? People avoid to stay away from, can people stay away from health system inequality and disparity burden HIV in US, South Africa? Let me see now. Here it says, achieving health equity and eliminating HIV/AIDS disparity requires multi-pronged approach that's tackling system issues. We have seen this one. Expanding access to comprehensive care. Expanding access to comprehensive care and prevention, which is good. And challenges discriminatory practice and beliefs by avoiding the perpetuation of stigma neglect of education and prevention, creation of health care barriers, and overlooking social determinant progress and overlooking social determinants, this progress can be made toward a more just and healthy future for all. Fantastic, which is good. Let's go to slide 17. Slide 17 is like my suggestion. What do I suggest? What do you suggest? Everybody has his suggestion on this issue because the issue is affecting people around the world, including my family, including your family, including your uh, friends whom you have the same lifestyle, whom you work together, whom you eat together, whom you joke together, whom you share material together. So it's you and me. Here is I put an ad that talks about HIV prevention, and all that we are talking here is about prevention, nothing else. Now, I believe in working together with communities. This is me. I believe in working with community, and therefore, my suggestion on health system inequity and HIV disparities here is my advice. It's good to recognize the crucial role of housing, addressing the social determinants of health, combat discrimination and stigma, invest in targeted intervention sources, and fostering collaboration and advocacy. By doing so, progress can be made toward achieving health equity, ending the HIV epidemic in our communities. That's my suggestion. Now, going to slide number 18 is just a conclusion of all what I have shared to you. And before I can read my conclusion, you see an ad here. There's an ad or a picture that is showing about health, talking about health. And three elements: social, culture, and economic. Now, the question is, how is your social? How do you socialize in your community? How is your culture? And how do you consider others' culture? Do you have social? Do you have social culture emanating in you? Do you care about someone's culture? I don't know. So here he's talking about culture and economy. How is your health? How is your economy? Are you poor? I don't know. Do you live under poverty or not? What do you think about being in poverty compared to these disparities? We have seen above here, we have seen uh, some of the social determinants that are triggering us, that are causing us having uh, uh, being contaminated with this issue. And we have seen social determinant like poverty, we have seen homelessness, we have seen social medical insurance and something else. So what do you think now? Okay, let's go to conclusion. My conclusion says, in conclusion, why both the US and South Africa struggle with healthcare inequalities, their impact on health problems like HIV and AIDS, the magnitude and underlying causes differ substantially. So the cause may differ substantially, with South Africa facing a more systematic crisis exacerbated by its history and socio-economic disparities. Let me repeat again. In conclusion, While both the US and South Africa struggle with healthcare inequalities and the impact on health problems like HIV and AIDS, the magnitude and underlying cause differ substantially, with South Africa facing a more systemic crisis exacerbated by its history and socioeconomic disparities. Now, going to number 19, just those references we may found all what I have said here. So the references here you may found in National Institute of Health. The website is here. You may find HIV-related disparities and inequalities in the United States from this website, www.thehousefmercy.com. The other one is Understanding Health Inequality, Disparity, and Inequities in South Africa, not in Africa, from the National Institute of Health. Website is here. Going forward, you may also find this information in HIV prevalence in South Africa through gender and racial lenses from International Journal for Equity in Health. Yeah, so this is what I have today for you guys, and I believe that you have heard me for what I've said. Once again, I'm Bahati Gadmunyempundu. I'm a student at Ohio State University, social work program, and I believe that you have heard what I've presented, but we need to wake up and uh, uh, be aware of the social determinant for us to be able to protect ourselves, to prevent our family, our community from being contaminated by this HIV AIDS. So I appreciate for being with you today, and God bless you. Thank you.